It's very difficult to remember that day on first earthquake. It was on Saturday. Saturday, our group A doctors, we were all together sitting in this hospital, making some good event. But unfortunately, we had a big earthquake at around 12 o'clock. It was very difficult time. I just remember how the patients were crying. Even we were not managing ourselves what to do. We don't understand what to do. So all patients were running outside the hospital, out of bed. Even post-operative patients with IV fluid, they were running outside the bed. When NICU, neonate baby, we have to take out in the outside the hospital bed. They were in trolley with oxygen. It's very difficult, tough time to understand.
I'm Nuria Diaz, psychologist in ACF for the psychosocial support program in Nepal. Now we are in the maternity hospital. Here we are conducting today a training for all health staff, especially nurses, to help them how to deal with all this stress situation they are managing after the earthquake. They are caregivers and we want to help them to cope with their own situation and also to help them with this role, taking care of the vulnerable population.
Though we were in big stress, myself and my doctors, our team, we thought that managing others to make a relief, like providing medical services to others, it gives us some kind of energy or some kind of stress management situation. That's why we came, all of us who were on duty, or even though those who were not on duty, we managed to come and help the other patients. That gives us energy to cope that stress.
Psychosocial needs are really high. People is very traumatized, especially because the event is not finished yet. We have a lot of aftershocks and people is all the time in alert situation. They are having a lot of anxiety, insomnia, self-esteem problems, and for them it's really difficult to cope with all this stress situation. For that reason, our psychosocial support program is so important for everyone, but especially for the more vulnerable population. Here in the hospital we have a baby-friendly tent. We are targeting mothers and their babies, and basically our intervention is offering psychosocial support. They can express how they feel and share experiences in a safe place, and also we are working with care practice through group discussions. In the group discussions, what we are working is breastfeeding, nutrition, hygiene practice, and how they are dealing with everything in their daily life. This is part of the psychosocial program here in Nepal, where we are working in the main hospitals in Kathmandu, providing psychosocial support, going to the communities through mobile units, providing as well trainings to teachers and some schools, and as well working in rural areas through this community approach, helping them how to deal with all this situation with this psychosocial support.